Welcome to Global RPH. In this video, we will examine the best sleep positions for health and what sleep positions to avoid. Also, we will discuss the long-term use of over-the-counter drugs such as Benadryl and the link to dementia. Finally, we will discuss all of the habits that help ensure a good night's sleep. Sleep is a fundamental biological process essential for maintaining optimal physical and mental health. The quality and quantity of sleep significantly impact cognitive function, emotional well-being, and overall physiological restoration. This comprehensive article explores various aspects of sleep optimization, including ideal sleeping positions, potential risks associated with certain sleep aids, and evidence-based sleep hygiene principles. By understanding and implementing these strategies, individuals can enhance their sleep quality and, consequently, their overall health and daily functioning. Adequate sleep is crucial for cognitive performance, emotional regulation, and physical recovery. However, many individuals struggle with obtaining sufficient restorative sleep, leading to a cascade of negative health consequences. This article aims to provide evidence-based recommendations for improving sleep quality through optimal sleeping positions, judicious use of over-the-counter sleep aids, and implementation of effective sleep hygiene practices. The position in which an individual sleeps can significantly impact the quality of their rest and overall health. While personal preference plays a role in choosing a sleep position, certain postures may offer specific benefits or potential drawbacks. Understanding these can help individuals make informed decisions about their sleeping habits. Sleeping on one's back, also known as the supine position, is often considered the most neutral and beneficial sleeping posture. This position allows for optimal spinal alignment, potentially reducing the risk of back and neck pain. Additionally, back sleeping may help minimize facial wrinkles and maintain even skin texture, as the face is not pressed against a pillow. However, back sleeping is not without its drawbacks. For individuals with sleep apnea or those prone to snoring, this position may exacerbate these issues by allowing the tongue and soft palate to collapse towards the back of the throat. Furthermore, some people may find it challenging to achieve restful sleep in this position due to discomfort or a feeling of vulnerability. To optimize back sleeping, consider using a supportive pillow that maintains the natural curve of the neck. Placing a small pillow under the knees can help alleviate lower back pressure and promote proper spinal alignment. Side sleeping is the most common sleep position and offers several potential benefits. This posture may help reduce acid reflux, alleviate snoring, and improve circulation. For pregnant women, sleeping on the left side is often recommended to enhance blood flow to the fetus and reduce swelling in the lower extremities. When adopting a side sleeping position, it's crucial to maintain proper alignment of the spine and neck. Use a pillow that fills the space between the head and shoulder, keeping the neck in a neutral position. Placing a pillow between the knees can help align the hips and reduce pressure on the lower back. However, side sleeping may contribute to facial wrinkles and breast sagging over time due to gravity's effects. Alternating sides throughout the night can help mitigate these potential issues. Stomach sleeping risks and alternatives. Sleeping on the stomach is generally considered the least advisable position due to its potential negative impacts on spinal health. This posture can strain the lower back and neck, as it often requires twisting the head to one side for extended periods. For individuals who find it challenging to sleep in other positions, using a thin pillow or no pillow at all can help reduce neck strain. Placing a pillow under the pelvis may also alleviate lower back pressure. Given the potential risks associated with stomach sleeping, individuals who prefer this position may benefit from gradually transitioning to side or back sleeping through the use of supportive pillows and conscious effort. In this next section, we will look at potential risks of diphenhydramine and cognitive health. Diphenhydramine, a common over-the-counter antihistamine, is frequently used as a sleep aid due to its sedating properties. While it can be effective for short-term use in managing occasional sleeplessness, concerns have been raised regarding its long-term impact on cognitive health, particularly in older adults. Anticholinergic effects and cognitive function. Diphenhydramine belongs to a class of drugs known as anticholinergics, which work by blocking the neurotransmitter acetylcholine in the brain. Acetylcholine plays a crucial role in various cognitive processes, including memory formation and attention. Recent studies have suggested a potential link between long-term use of anticholinergic medications, including diphenhydramine, and an increased risk of cognitive decline and dementia. a prospective cohort study published in JAMA. Internal Medicine found that higher cumulative anticholinergic use was associated with an increased risk of dementia, short-term cognitive impairment. Even in the short term, diphenhydramine can cause cognitive impairment, including decreased alertness, impaired memory, and reduced reaction time. These effects can persist into the following day, potentially impacting daily activities and increasing the risk of accidents. Alternatives and precautions. Given these concerns, it is advisable to use diphenhydramine sparingly and only for short-term management of occasional sleeplessness. Individuals, particularly older adults, should consult with their healthcare providers about alternative sleep aids or non-pharmacological approaches to improving sleep quality. For those who rely on diphenhydramine for its antihistamine properties, discussing alternative medications with fewer anticholinergic effects may be beneficial. Additionally, implementing effective sleep hygiene practices can often address sleep issues without the need for medication. Best over-the-counter sleep aids. When non-pharmacological approaches to improving sleep prove insufficient, over-the-counter sleep aids can offer temporary relief for occasional sleep difficulties. However, it's crucial to approach these medications with caution and under the guidance of a healthcare professional. Here, we explore some of the most commonly used OTC sleep aids, their mechanisms of action, and considerations for their use. Melatonin supplements. Melatonin, a hormone naturally produced by the pineal gland, plays a crucial role in regulating the body's sleep-wake cycle. Melatonin supplements are widely available and are often used to address jet lag, shift work sleep disorder, and general difficulties with sleep onset. Exogenous melatonin supplements work by mimicking the body's natural melatonin production, helping to signal to the body that it's time to sleep. Generally considered safe for short-term use, melatonin has shown efficacy in reducing sleep latency, the time it takes to fall asleep, and improving sleep quality in some individuals. However, its effectiveness can vary significantly between individuals. Typical doses range from 0.5 to 5 milligrams, taken 30 minutes to an hour before bedtime. It's advisable to start with the lowest effective dose and adjust as needed under healthcare provider guidance. While melatonin is generally well tolerated, potential side effects can include daytime drowsiness, headaches, and dizziness. Long-term safety and efficacy data are limited, and melatonin may interact with certain medications. Valerian Root. Valerian Root is an herbal supplement that has been used for centuries to promote relaxation and improve sleep quality. The exact mechanism is not fully understood, but valerian is thought to interact with gamma-aminobutyric acid, or GABA, receptors in the brain, promoting relaxation and sleep. Some studies suggest that valerian may improve sleep quality and reduce sleep latency, though results have been mixed. It's generally considered safe for short-term use. Typical doses range from 300 to 900 milligrams, taken 30 minutes to 2 hours before bedtime. Side effects are generally mild but can include headache, dizziness, and gastrointestinal disturbances. Valerian may interact with certain medications and should be discontinued several weeks before surgery due to its potential effects on anesthesia. Doxylamine. Doxylamine is an antihistamine with sedating properties, commonly found in over-the-counter sleep aids. Like diphenhydramine, doxylamine works by blocking histamine receptors in the brain, promoting drowsiness. Doxylamine can be effective for short-term use in improving sleep onset and maintenance. However, it shares similar concerns with diphenhydramine regarding potential anticholinergic effects and is not recommended for long-term use. Typical doses range from 25 to 50 milligrams, taken 30 minutes before bedtime. Side effects can include daytime drowsiness, dry mouth, and constipation. As with other antihistamines, there are concerns about potential cognitive effects with long-term use, particularly in older adults. Magnesium supplements. Magnesium is a mineral involved in numerous bodily processes, including the regulation of neurotransmitters that promote sleep. Magnesium may help promote sleep by regulating the production of melatonin and increasing levels of gamma-aminobutyric acid, or GABA, a neurotransmitter that promotes relaxation. Some studies suggest that magnesium supplementation may improve sleep quality, particularly in individuals with magnesium deficiency. It's generally considered safe when taken at recommended doses. Recommended doses typically range from 200 to 400 milligrams taken before bedtime. However, high doses of magnesium can cause gastrointestinal side effects such as diarrhea. And individuals with kidney problems should consult a healthcare provider before taking magnesium supplements. Considerations for OTC Sleep Aid Use. When considering the use of over-the-counter sleep aids, it's important to consult with a healthcare provider, especially if you have underlying health conditions or are taking other medications. Start with the lowest effective dose and use the product only as needed. Be aware of potential side effects and discontinue use if adverse reactions occur. Avoid long-term reliance on sleep aids and focus on addressing underlying causes of sleep difficulties. Implement good sleep hygiene practices in conjunction with any sleep aid use. Evidence-based sleep hygiene principles. Sleep hygiene refers to a set of behavioral and environmental practices that promote optimal sleep quality and quantity. Implementing these evidence-based principles can significantly improve sleep outcomes for many individuals. Maintaining a consistent sleep schedule, even on weekends, helps regulate the body's internal clock, also known as the circadian rhythm. Aim to go to bed and wake up at the same time each day, allowing for a 7 to 9 hour sleep opportunity. Research has shown that irregular sleep patterns are associated with poorer sleep quality and daytime functioning. Consistency in sleep timing can help improve sleep onset latency and overall sleep efficiency. Creating a sleep-conducive environment is crucial for promoting restful sleep. Key considerations include maintaining a cool bedroom temperature, typically between 60 to 67 degrees Fahrenheit or 15 to 19 degrees Celsius. Use blackout curtains or an eye mask to minimize light exposure. Utilize white noise machines or earplugs to reduce disruptive sounds. Invest in a supportive mattress and pillows that promote proper spinal alignment. Studies have demonstrated that optimizing these environmental factors can lead to improvements in sleep quality and duration. The blue light emitted by electronic devices can suppress melatonin production and disrupt the natural sleep-wake cycle. Implement a digital curfew by avoiding screens for at least 1 to 2 hours before bedtime. If device use is necessary, consider using blue light filtering apps or glasses to mitigate the impact on sleep. Research has shown that reducing evening light exposure, particularly from electronic devices, can improve sleep onset and quality. A regular exercise. Engaging in regular physical activity can promote better sleep quality and duration. However, timing is important. Vigorous exercise close to bedtime may have a stimulating effect. Aim to complete intense workouts at least 3 hours before bedtime. Moderate intensity exercise, such as yoga or stretching, can be beneficial when performed closer to bedtime, as it may help reduce stress and promote relaxation. A mindful eating and drinking habits. Dietary choices can significantly impact sleep quality. Consider the following guidelines. Limit caffeine intake, especially in the afternoon and evening. Avoid large meals close to bedtime, as digestion can interfere with sleep. Minimize alcohol consumption, as it can disrupt sleep architecture and quality. Stay hydrated throughout the day, but reduce fluid intake close to bedtime to minimize nighttime awakenings. Research has demonstrated that adhering to these dietary principles can lead to improvements in sleep onset, duration, and quality. Stress management and relaxation techniques. Chronic stress and anxiety can significantly impair sleep quality. Implementing stress management strategies and relaxation techniques can help promote better sleep. Practice mindfulness meditation or deep breathing exercises before bed. Engage in progressive muscle relaxation to reduce physical tension. Consider cognitive behavioral therapy for insomnia, or CBTI, for persistent sleep difficulties. Maintain a worry journal to address concerns before bedtime. Studies have shown that these techniques can be effective in reducing sleep onset latency and improving overall sleep quality, particularly in individuals with stress-related sleep disturbances. Napping guidelines. While short naps can be beneficial for some individuals, excessive or poorly timed napping can interfere with nighttime sleep. Follow these guidelines for optimal napping. Limit naps to 20 to 30 minutes to avoid entering deep sleep stages. Avoid napping after 3 p.m. to prevent interference with nighttime sleep. Consider coffee naps by consuming caffeine immediately before a short nap for enhanced alertness upon waking. Research has demonstrated that adhering to these napping guidelines can help maintain a healthy sleep-wake cycle without compromising nighttime sleep quality. Addressing sleep disorders. While good sleep hygiene can address many sleep issues, it's important to recognize when professional help may be needed. Signs of potential sleep disorders. Chronic difficulty falling asleep or staying asleep, excessive daytime sleepiness, loud snoring or gasping during sleep, restless legs or periodic limb movements during sleep. When to seek professional help. If sleep problems persist for more than a few weeks despite good sleep hygiene practices, If daytime functioning is significantly impaired due to sleep issues, if you experience any of the signs of potential sleep disorders mentioned above. Professional interventions, sleep studies or polysomnography to diagnose specific sleep disorders, cognitive behavioral therapy for insomnia or CBTI, medical treatments for conditions like sleep apnea or restless leg syndrome. Implementing these sleep hygiene principles can significantly improve sleep quality and overall well-being. However, it's important to remember that individual needs may vary, and what works for one person may not work for another. Patience and consistency are key when making changes to sleep habits. If sleep problems persist despite adherence to good sleep hygiene practices, consulting with a healthcare provider or sleep specialist is recommended to address any underlying issues and develop a personalized treatment plan. Conclusion: optimizing sleep quality and quantity is essential for maintaining overall health and well-being. By implementing evidence-based strategies related to sleeping positions, judicious use of over-the-counter sleep aids, and adherence to sleep hygiene principles, individuals can significantly improve their sleep outcomes. It's important to recognize that sleep needs and preferences can vary among individuals. Experimenting with different approaches and consistently practicing good sleep habits can help identify the most effective strategies for achieving restorative sleep. For persistent sleep difficulties or concerns about sleep-related health issues, consulting with a healthcare provider or sleep specialist is recommended. They can provide personalized guidance, assess for underlying sleep disorders, and offer appropriate treatment options when necessary. By prioritizing sleep health and implementing the strategies discussed in this article, individuals can work towards achieving the restful, rejuvenating sleep essential for optimal physical and mental functioning. If you enjoyed this video, please like and subscribe. Here at Global RPH, we are working hard to grow this new channel to meet the needs of our viewers. Please pass this video on to any friends or family that are experiencing issues with sleep.